chief trainee hai. All right. Okay, so uh, all right, so just a quick word here, which we, while you're looking at the EUS and start trying to study that, we just are trying to. So basically, when you're doing the sectoral scanning, which is the linear, which we're going to talk mostly here, you're going to talk. It's like constructing an elephant by touching at different parts. So because you're looking at parts and this and that, you're looking at pancreas from different angles and different. So so everybody has his own concept of what the elephant would look like. So that's one of the issues here. And then what is practical, as all of the faculty yesterday and Dr. Saad said and Dr. Khalid said that not all the details are required. So don't get into a nitty gritty when you're in the beginning. Just look at the, major vascular identification is enough. There is definitely, you have to unlearn previous things. You have to unlearn how you look at the anatomy, and you have to unlearn what you're doing. If that template keeps on interfering with your new learning. So so what I meant is, I would emphasize here that you need to sort of think about it rather than trying to look at the videos and look at it. Just think about it, what's happening with the score, what I'm doing when the patient is lying like this, what is happening here. So that's one. And that's what does. Your brain tries to orient pictures according to what should be rather than what is. So you want to look at it. Oh, the portal vein should look like this, and then what happens is that you're trying to find that sort of an image there. Don't do that. As Dr. Khalid last emphasized, just look at the station and see, what the anatomy is, basically. So don't try to superimpose your previous templates on that. So the reason is, of course, that sometimes the same image, if you just rotate the scope a little, you will have it in longitudinal section, sometimes oblique, sometimes short axis. So, and of course, images are, of course, grayscale, so they don't tell you, what is happening. No colors there to differentiate between things and all that. All right, so why the vessels? Vessels are very important. They serve as guide to other structures, and they can be source of confusion during exams. So if you look at there are a lot of vessels coming up there, you don't want what it is. So they can cause confusion, and this is because of conventional teaching. As I said, as I emphasized just now, that if you do not, we're just telling you the main vessels and we're not telling you the other vessels. I'll just put an example for that. You would say, well, while you're doing it, what is this? Where am I? So it disorients you. And of course, there is variation in anatomy. So they're important in staging of disease, and in the future, as I said, they're going to become therapeutic targets and themselves, and they'll be important in therapeutic targets. You'll have to identify the vessel where what you're doing there. All right, so how can we effectively, I think, station approach, I'll not go into that, we already talked about it. And should we look at them as a continuous vascular structures, or we look at them region-wise? So I think my suggestion is that if you just think of them as a whole structure which you can follow, then probably it's much better, because it leads you to sort of other structures, and it sort of gives you a whole holistic picture rather than if you divide it into region-wise. Just an example, for example, Gray's anatomy was systemic. It was difficult to initially, but it was easier once you followed it. And the other which we did for the other one, Snell's, yeah. It's used to be regional wise, and it was very last. It was very difficult, isn't it? It was region wise, and then we had a difficulty bringing it together. So it's probably it's good to have them as continuous vascular structures. So what we are going to, I'm going to skip radial because I think we're not doing radial, and we're not going to, so I'm going to concentrate more on the linear. So let's start. Region-wise, you can have neck and mediastinum, stomach, station-wise, different stations by different people, as we talked yesterday, so we're not going to do that. It has its own disadvantages and advantages, but let me go through them quickly. So what are we looking at? So arterial and venous. So vessels, major vessels which we look on, basically EUS is either arterial or you have the venous channels. And so aortic arch and its branches in the neck and in the mediastinum, great vessels in the heart, celiac and SMA, aorta and its branches in abdomen, and then you have veins, mediastinum and neck, of course, and then you have superior and inferior vena cava, hepatic veins, portal vein and its branches, mesenteric vein and its tributaries. So, you know, that's you have to learn. So if you master the vascular anatomy, actually you will master the whole EUS. So let's look at this. So as I said, it may be a better idea to just have the holistic concept. So the aortic arch goes like this. This is what you have in thoracic part. You have the arch of aorta. Now I want you to flip this picture like this. Make it horizontal here. That's how the patient is lying. So he's not lying this. He's lying horizontally like this in the left lateral position. So if you flip that in your mind, so this will come like this. So you would have the carotid going up there, subclavian going up there. You would have these vessels going up there, the aorta coming like this, the celiac, and they're coming like this. And now, if you take the spine as a center reference point, and now you can see, look at these, how it rotates. So if it will rotate like this towards this, so if you have a scope down like this, and the patient is lying horizontal, so the scope is actually like this, right? So it's like this. Oh, military grade. So I hope it's not. Yeah, इसके कुछ रख दो बेटा.
सर इसको
नहीं बेटा इधर ना स्लिप यहीं स्लिप ओके वो इस पर नहीं आ रहा ओके इसको नहीं बेटा इसके नीचे कुछ रखो इसके नीचे ऐसे यहाँ रखो कुछ नहीं कुछ और करना पड़ेगा yeah for a temporary it's okay alright so I just want to orient yourself so if you do like that so if the scope is moving like this which means if you're moving clockwise actually here and the scope is facing outwards so you will be actually moving towards the common carotid this subclavian rather than and if you move it to the opposite side you're going to move towards the so what I'm saying is that if you just have this picture in mind then will actually the rotation of the scope would make sense to you what structures you're going to be looking at because sometimes
So as far as I conceptualize it is that once we produce the scope and we're in the southwest so the transducer of the scope is actually facing towards the sternum.
yes
So then based upon that using as a reference then we can orient ourselves.
Yeah. What I'm saying is, but for the rotation purposes, take this, for example, if the patient is lying like this, take the spine as the central part. Because if you rotate it, if the scope is facing posteriorly, if the scope is facing posteriorly, the rotation, the scope when you will rotate it would be in opposite direction to when if it is facing anteriorly. Okay, like this. If the scope is facing anteriorly, if you move, let's say to the clockwise, so where would the scope face? Well, let's suppose you're here. Here when you
that
face,
right, that part I understand, but basically I just wanted to
Yeah.
initially once we've got the scope
Yeah.
inside, the
Yeah.
transducer is actually facing
That's true.
the sternum.
yeah. depending if you how you're going to introduce that.
Right.
If as Dr. Khalid has told you that if you're reducing that, yes, it would be facing anterior.
Sternum. So
Yeah.
then basically based upon
Yeah.
that we
But if you rotate and you have the aorta in view, then it is facing posterior. When you bring the aorta in view. Yeah.
right.
Yeah.
Transducer is facing anterior.
Yeah, that's true.
Right. Once basically once
Yeah. Of course, if you're looking at the heart, then it's facing anteriorly, right?
right.
Yeah. But the patient is like this. So it is actually like this. It is facing anteriorly and it is like this. All right. So then the rotation would make sense and the structures would come. All right. So as I said, as Dr. Khalid also said, if you do a sweep here, you can actually look at all these things in one go. That's what he was talking when you say that instead of looking region-wise, yes, you can region-wise, but you can sweep it and you can look at it all, right? Okay. No. No, that's not. Now it would start. Aftershock. Okay. Right. So here it is. So now the patient is lying horizontal like this, and so the arch of the aorta will come like this. This is the ascending aorta. This is not here. Arch of the aorta here. You have the pulmonary artery here. So now it would probably make sense if the patient is lying horizontally. So now if you're facing towards the aorta, arch of the aorta, and if you rotate the scope like this, so what would you see? This is pulmonary artery, aorta, LV. This is the mediastinum, right? So you're facing now interiorly. So if you face clockwise, where would the scope go? Just a quick orientation. No. The scope is facing anteriorly. The esophagus is posterior to the heart, right? Now if you, like this, if you go towards your right shoulder, the scope would go to the right of the patient. Upwards. It will go to the right of the patient. When you go to your right shoulder,
Main goal is that, like, would it go on the right
or the left?
Which side of the
patient?
Right.
Right, very good. So if you move towards your left, it will go. But if it is facing posteriorly, this will be opposite.
Yeah.
Right? Now you're going to, from this position, if you go to your right, as you start moving towards your right shoulder, the scope would also rotate toward the right of the patient, right? And then you will start seeing the right side structures like the superior vena cava, the inferior vena cava, the right atrium and all this. If you start moving towards the left, you'll start seeing this left, right? And if you move a little more left, you'll start seeing the pulmonary triangle. So this is important when you start doing that, and you need to know how this scope is facing and how the patient is lying, and then you look at the anatomy, right? Okay. So here, do you think this is more rightward rotation or leftward rotation as compared to this one? Just a conceptually speaking. So does the aorta go behind the pulmonary trunk or does it go anterior to the pulmonary trunk? It goes behind the pulmonary trunk, right? So
This is posterior.
no.
There it is posterior.
Okay, so what I'm saying is, look at this pulmonary artery. It's the same pulmonary artery here. So this is the pulmonary trunk and this is the right ventricle here. And look at this, if you go towards the left, this is aorta and this is the left ventricle here. So it's just the rotation, all right? It's just to give you an idea that the rotation makes a difference, and then you have to take it very slow to them. Okay. All right, so this is one of the views from that. So if you're good enough, you can actually look at the coronaries also, but that's just besides the point. Basically, this is the views from the what we call as, we were talked yesterday, what is this window? Subcarinal, not the AP window. This is subcarinal window. This is below the carina. So as I said, this is in the mediastinum. We are looking at the heart, all right? And
So at what centimeters there from the incisors?
don't go into that.
Don't
Don't do that. Identify the structures. Because once you're inside, you'll be saying 30 centimeter, 47. No, but if it's a taller guy or it's a shorter guy, it will be different, isn't it? Identify structures. Get familiar with the structures. Do not get into this, okay, where it is. I'm just orienting you because why I'm orienting you is if once you get lost, you need to know what's happening with the scope and knowledge. No, no, no. I'll show you that. Okay. All right. So basically, again, this is the non-coronary cusp. This is the right coronary cusp and all this. Okay, let's go to mediastinum. You can follow the left coronary artery for some time. Okay, this is what you're going to look for. This is the neck. Dr. Khalid actually, when he was doing that, he showed you yesterday. You know, once you go this is the arch of the aorta. This is the left brachiocephalic. This is the left common carotid. This is the arch of the aorta, right? Once you go in, this is what you start looking for. This is the neck. As you go down, this is what you're going to be looking at. All right, this is the familiar station. This is the aortic arch. This is the pleural surface here, which is reflecting. I think the basics Dr. Mustafa discussed. This is reflectivity once you have an interface, which is, all right, so this is one. Okay, this already we discussed that. I think I'll not go into that. Okay, this is in the neck. As I said, left brachiocephalic. This is, you can, if you pull up, you can also look at the thyroid and all those things. I think Dr. Khalid already did that. Well, if you're very good, I think, I don't think we'll be able to pick this up, but Dr. Khalid may be able to do that, and Dr. Mustafa, you can pick up these also, all right? Okay, so once you've done that, then you go on to the aorta behind the pancreas, or imaging from aorta below the pancreas. So once you're in the abdomen, it is above pancreas, behind pancreas and aorta.
These are the stations according number 1 means in the
Yeah,
stomach.
well, as you said, don't go into the, yeah, now it's misbehaving. All right. Yeah, yeah, as I said last, again I would emphasize, don't go into these stations or something like that. Just conceptually, just to make you, give you an idea that this is where you need to look also. Identify the structures, follow them. Do not get confused with the stations and all those things. Just identify the structures, all right? Okay, yeah, all right. The idea is once you are in that area, probably these are the areas you need to scan above the pancreas and all those things. So you need to identify, once you identify the pancreas, above the pancreas and below the pancreas. Okay, so this is what looks like. We've already seen that. I think repeatedly it has been repeated. This is the celiac, this is the spherem mesenteric. You put a color flow there, and that's how it looks like. All right, this is above the pancreas, of course. And this is how it divides. So the hepatic is going down. Splenic, I think Dr. Khalid and Dr. Mustafa has shown you yesterday very nicely. This is the same thing I'm repeating here. So the one which goes above, once you have the celiac dividing into 3, hepatic goes down, left gastric goes this way, splenic this way, and now you follow this splenic to go to the pancreas. So if you follow the structures, if you remember my first slide, if you follow the structures, you will end up on the desired place where you want to be. Okay. So just forget about that. Okay. So now just to give you an idea, so if you go in the third part, many people do that. The way you want to go is put the scope in, pull it out, pull it together. You can actually go just under that, but so this is how the aorta would look like. And you would have this right renal coming out there. Yeah, this happens in the books and all those things. You're unable to get that. Don't try to get that if you can't get that. As I said, do not try to fit this template in the third part. So if you can't get it, fine. But as Dr. Khalid has yesterday shown you in the live demonstration, if you can identify the aorta, that's enough. That would orient you to, so you would have 2 structures on this side, 2 structures on that side. All right. Okay, so again, so you have this aorta here, you have SMA coming up here, and you have this sphenic artery here, and you can have the vein, left renal vein, in the between the superior mesenteric and all these things. Okay, this is SMA again, and this is the aorta, and this is where we are at that moment. This is how it will look like. Just to give you an idea, okay, you don't have to exactly, these are not, you're not going to be able to get all these images in all the patients. Remember that. These are images in the books selected for the understanding purposes. You will not be able to get them in all the patients all the time. So it's just to make you understand the orientation. So this is the aorta coming up here, left renal artery, left renal vein. You'll have the pancreas above there, artery, this is the splenic artery and splenic vein here. And then you have the right renal artery here. The picture is switched on. Okay. Again, anybody? Where is the scope at the moment?
So if you have to say a
Yeah.
station, by book,
Yeah.
which station is that? If you have to say the station, which station is that? So just remember, where is the pointer?
Very good.
So
yeah,
you
try
see
to identify
that-
the structure.
Exactly. You
Try
see
to
this-
identify the structures and then tell me what's happening here.
Splenic vein is making conference with superior mesenteric vein. and
Yes.
Both are dipping
So
downward.
why is the splenic vein coming from above? So the patient is lying like this. You're looking at here. The splenic vein should be coming like this. Why is it coming from above? Any idea? This is what I wanted. Yeah. Because, okay. So why is this coming from here and then going like this? The portal vein the splenic vein should be coming like this and going up like this, isn't it? That's what you think. That's what your anatomy should tell. That's what should be logically. Anybody? Okay. So the transducer is always on the top. But when you are in the patient, the transducer is always changing the position, isn't it? But on the picture, on the EUS, it's always on the same place. So what does that mean? So the machine, what it does is that wherever you're looking from, like right, left, up, down, it actually flips the picture to make the transducer come up here. All right? So this is what you're looking at from the gastric station. Patient is lying like this. You're looking at this portal vein like this. From here, it is coming like this and going like this. But what does this? Because you're looking at it from here, it flips the picture like this. So now imagine, portal vein was coming here like this, going like this. So bile duct was coming like this, going like this. Portal vein was like this, 45 degrees. And you had the hepatic artery coming from here, going like this, right? Now flip the picture. All right. So let's flip it. So this is now what is happening. The splenic vein was coming from here and joining it like this, right? Now you flip the picture. Now once you flip the picture, the splenic vein is coming like this. The pancreas actually above. The liver coming like this. This portal vein was going like this. This is coming like this. The bile duct is now here because it was here, right? Exactly. Now that is the reason that the yes. So is it ठीक होगा कि नहीं? Okay. Now, so if you अब आप देखें यहाँ से if you follow the splenic vein yesterday, if you follow the splenic vein above and rotate it medially and pull so you're actually the maneuver which you're doing is you're pulling it up, you're rotating it medially and all those things, and the splenic vein still remains in view. And the reason if it was coming from that side, it would not remain in view, right? Isn't it? So there's now a disconnect between what you're doing and what you're getting here. And the reason for that is because it flips the picture. All right? So that is also the reason that I want to understand you this concept. That is also the reason that it gets flipped in the D1 and D2. So you go up like this, it actually flips the picture, and your bile duct is actually on the opposite side, and the portal vein is on the opposite side. All right. So we'll not go into this because this is for advanced. Because for the same view, if you rotate the scope like this, you can actually get the aorta, you can get the gonadal, and also you can get the pancreas, but we'll not go into that. All right, so this is, anybody? This view is from? We haven't talked about anything, Doctor. Nope, no. This is coming from here, this is coming from here, this is the aorta, and nothing else is around here. This is actually from the rectum. All right. All right. Okay. So, this is. All right. Just few views. I'll just quickly go through them so that we can start with the hands-on. So, this is descending aorta, pleura, all those things. Just the images. Okay. So, where are we now? This is just a quick quiz. We'll just go through this quickly, honey. Yeah, this time. Very good. Okay. Yeah, just forget that. Honey. All right. Now the veins. So we'll just switch to the veins now. All right. So three major veins: portal vein, splenic vein, and all these things. And the tributary, the diaphragm also shows some important relation to the veins with abdominal organs. Marks veins which have a variable pace of joining portal venous system. So this is what the anatomy should look like, right? But now let's flip this patient. So he is going to be like this. So liver is going to be here, spleen is going to be here, splenic vein is going to be here, portal vein is going to be here, and mesenteric vein is going to be here. All right. So just flip the image. That's what actually the position of the patient is. All right. I should have flipped them for you. All right. Next time I'll do that. All right. Now here's what I was talking about, the anatomy. So do not get into the branches. So look at this. You can have this superior posterior duodenal vein, and this, and it can look like this, it can look like this, it can look like this. So the anatomical variability. So stick to the main veins when you're learning already. All right. Okay. So just a quick one. Here you go. All right. So we'll not go into the detail of this. This is again how the portal vein tributaries and its branches. Okay. So where are we? Quick quiz. I'll point out, this is inferior mesenteric vein, superior mesenteric vein, portal vein, con bile duct, portal vein here, left gastric vein here. No. Yeah, I just wanted, this is just to a little bit of create a little bit of confusion. So as I said, the templates which you create in your mind would cause you problems here. So what's the problem here? It's the same picture. It has been flipped. Look at the head side is this side. So normally what we are doing, what the teaching is, what the Americans teach is you have the head side on this side. The Europeans teach with the head on this side. It's the same picture, but the head is on the other side. All right? So see what happens if you created a template. If you
Yeah, the other thing is like it's easy to pick it.
Yeah.
If it was a duodenum,
Yeah.
viaduct should be closer to the transducer.
Yeah.
So that's it. Just
So
remember
so the
that
point is,
viaduct is under away
Yeah.
from the transducer as compared
Yeah.
to the portal vein. That means you're not in the duodenum. That's
Right.
an image from the stomach.
Yeah.
So that flips when
Yeah.
you're in the duodenum.
right. So the idea is to tell you that you have to learn it yourself. Identify the structures. Don't try to fit the template on that. You see, your template is just reverse here.
अगर आप ऐसा भी बता दें, it should remain portal vein. अगर ये portal vein नहीं तो you can get the same image from
Yeah,
stomach.
yeah, you're right. Right. See,
अगर labeling
so
हटा दें,
yeah. So just trying to make a point here. Identify the structures. All right. Not the station all the same. All right. Okay. Again, look at the head side here. So again you have con bile ducts. Just to give you a idea basically. Okay. Yeah, I will just flip that. Okay. Again. So where are we now? We've gone through this. Dr. Khalid is actually and Dr. Mustafa is. Yes, very good. No, so we are getting there, right? So as you said, there's always hope. Bilkul sahi. So so the first structure in between the duodenal wall and also I'll just intentionally cut this side. So GDA and con bile duct and portal vein, and what is this structure? Yes, very good. So it will be hepatic artery there. All right. So this should be the duodenum. And where is the head end on this side? हाँ, head end के side पे होगा इस साइड क्योंकि ये पिक्चर फेमिलियर है, isn't it? अगर ये हेड एंड इस साइड पे होता है तो ये उलट होता है, ठीक है ना? चलो, ओके, वेयर आर वी नाउ? ये होता है splenic vein, left renal vein, aorta. Yes, so left renal vein join कर रही है, aorta को जा रही है, splenic vein, so you know, so okay, left kid, so left. Yeah, okay, so if wanna everybody going to go for long live cases, we can finish it up here, and in the meantime बाकी आप जारी रखें अपना काम. Okay. So just to give you an idea, this is the splenic vein. So this is the spleen here. So these are tributaries, splenic. There's a splenic artery here. So that's, where are we now? In the stomach and rotating towards your right shoulder, towards the tail of the pancreas. ठीक है, you getting it? Well, नहीं है तो interrupt. So this is what it is.
In the stomach, if you rotate towards
Right, there you go.
left, then it's
Yes, there you go. So you're getting there. All right. Again, what is this? You saw them yesterday. Splenic vein, splenic artery. Let me tell you, spleen is here, kidney is here. And there is a hypoechoic here and the hyperechoic. Left adrenal. Very good. So where are we? All right, there we go. So what I'm saying is the spleen, the vessels are a guide to a lot of structures. ठीक है कि नहीं? So that's my second point which I made there. And look at here. This is the aorta here. This is left renal artery. This is left renal vein. This is the LASV. So what is this picture? Is this a linear or is this radial? Can you see all of them in a radial?
in a radial image, you should have a circle in the center.
Yeah.
You've got a translucent.
Yeah, but look at the pancreas going from here to up to here. You have this splenic artery here, and you know left renal vein also coming up here, left renal artery coming up here also. So this is actually a radial scan, just to give you an idea. Yeah, that's all. ठीक है ना? So what I'm saying is, again, just to put it up here, just to tell you, identify the structures and try to make out a picture from there. And if you just change the template, you know, it changes everything. All right. Okay. We'll just skip through because these are radial pictures, so we're not doing the radials here. So, okay. Look at this one.
Yeah, I've had a message, so I have to send
Yeah. चलेगी. All right. Okay, so yeah, I think will not confuse you there. Okay, again. Any idea? Where's the head? This was, you know, the exercise was here. What I meant to do was that you guys should be trying to mentally flip the images right. Should be able to do that. All right. But that's the point. You don't have to get confused by that. All right. Where are we? Okay, this is the pancreas. This is the splenic vein coming up from here. This is the superior mesenteric vein. This is the first jejunal vein. This is the inferior mesenteric vein. ये pancreas है. डॉक्टर साद न्याज कहते हैं ये सबसे डिफिकल्ट स्टेशन है. Here's a hint. D2. Okay, so they remember what you tell them. Okay, now it makes sense, isn't it? The splenic vein is coming from where it should be coming. The patient is lying like this. Spine is in the center. You're looking at it from like this. The pancreas is like this, right? So the splenic vein is supposed to come like this. Mesenteric vein is supposed to come like this. Jejunum should join like this, and inferior mesenteric. Doesn't make sense. Now it makes anatomical sense. So here, it makes anatomical sense. So if the patient is lying like this is the pancreas here. So if you rotate it towards your right shoulder, what are you going to see? More of pancreas and all those things. If you rotate it like this, which is towards your left shoulder, what are you going to see? Left vena cava kidney, जो कल उनको बता रहे थे आपको. Two structures on the. अच्छा, इस साइड पे देखेंगे तो क्या आएगा? Bile duct, pancreatic duct, and release. So does it make sense?
सर को बता देते हैं सर हमने ये किया है पता अच्छा
ऐसे pancreas usually
अनाउंस कर दिया
because the patient is in this.
हेलो अस्सलाम वालेकुम
भाई माइक